Welcome back. Yes, as you might have seen there, we do have Dr. Sani Aliyu, who is the National Coordinator of the Presidential Task Force on COVID-19. Good morning, and thank you for joining us today on the program. Well, what a time that we're in, not just in Nigeria, globally, but picking up the dailies, different things jump out to different people. Well, we do know the COVID-19 team had their time, the session in the National Assembly, but then generally speaking, from perhaps the perspective of yourself, if you could also speak for some members of the PTF, do they feel somewhat helpless? Because I mean, yes, you've eased the lockdown in some states. We've seen what's playing out in some states. What's the thinking at the moment with the PTF?
So with the PTF, we continue to work very hard to ensure compliance with the guidelines that we have set up. I think what is important for the public to understand is when you look at the guidelines, the key elements that we keep on talking about. So maintaining a safe distance of at least 2 meters, for instance, washing your hands or sanitizing your hand, wearing a mask, keeping away from crowds, etc. These elements all need to be done at the same time for them to be effective. You cannot pick and choose. And it's when you do the elements combined that you tend to have a similar effect to that of a lockdown. Behavioral change has always been difficult. If it comes to everything, really, it's not just an epidemic situation. But we will continue to work very hard with the public to push through this idea that we have to change. We now have an epidemic going on. It doesn't matter if you are wearing a mask. If you continue to expose yourself to large crowds, eventually you will get this infection. Why? Because the mask can only protect your lips and your mouth. It doesn't protect your eyes. So somebody standing very close to you and shouting or talking could easily infect you through your eyes. At the same time, if you have contamination of surfaces, for instance, and you touch a surface and you touch your face, you still have that problem. And that's why we keep on saying you have to deliver those key elements together as a bundle. I know it's been difficult. People have been in their homes for a long period of time. Some don't have money, and there's this huge rush towards banks, etc. But at the end of the day, it's our personal responsibility to remain safe. This epidemic is far from over. There are people out there that are infected. You don't want to go to a bank to get money and you end up getting coronavirus. So my strong advice to the public is, if you see a crowd, keep away from them. Maintain a safe distance. Keep your loved ones safe. If you have an elderly person at home or somebody who has underlying illnesses like diabetes, etc., urge them not to go out. And even you yourself, if you don't need to go out, stay at home. That's the message. Stay at home if you don't need to go out. Just because we've lifted parts of the lockdown to allow people to get food and to allow people to go to banks and to allow people to have some semblance of normalcy doesn't necessarily mean that we're back to normal.
Well, concerning the messaging, I mean, yes, we'll continue to put out all those messages and new advisories and as the information comes through, because, I mean, this is novel. But from what we then see, how people are responding to the messaging, I mean, we just saw some scenes which you never want to see in Gombe. And then some of the areas you also highlighted, some states who are congregating, getting there and not even giving any thought whatsoever to the social distancing. What is the thinking now? What do you think the approach should be concerning messaging and ensuring that it gets across to such people and then they understand the gravity of what we're dealing with?
So, of course, it's the responsibility of government to make sure that everybody is aware of his or her risks. And we continue to work very closely with the Federal Ministry of Information as well as the Nigeria Orientation Agency. In Kano, for instance, we're introducing this 7-day motorized campaign where we go through the normal traditional media routes rather than just TV or radio, have loudspeakers going around through people's residences, telling them to stay safe, keep home, and pushing through those messages. At the same time, we're also working with the security agencies to see how we can enforce some of these measures. The key thing to remember is, unless these measures are followed, this epidemic will not go away. Yes, it's an invisible enemy. Yes, it's not very obvious when you go out. It's not like you go out and you see people with guns, etc. So that risk, that perception of risk is very different to that of a real threat that you see physically. But nevertheless, it is still there. And it's extremely important that all elements of government come together, as well as the public, to have a common interface so that we continue to have those discussions. The guidelines that we have set up, they're not really that difficult to follow. Keeping 2 meters away from a person is not really that difficult if you really want to do it. Wearing a face mask isn't that difficult, provided you have access to these face masks. And I know there are state governments that are buying face masks or commissioning tailors to do face masks. They don't need to be medical face masks. Any sort of scarf around your face would give you a degree of protection. We all have to have responsibility for ourselves as well as responsibility for our communities. What happened with the rioting was extremely unfortunate. We are very concerned as well, and we'll continue to work with state governments to make sure that whatever accommodation is provided to people who are infected is accommodation that they can comply with and stay in, and especially if they are fairly well, because the majority of people, 80% of those that catch coronavirus, will have mild or moderate symptoms. They will feel fairly well. It will not stop them from doing their normal activities, but nevertheless, they can still transmit that infection. And the reason why we isolate them is not because they need to be treated. No, it's because we want to move them out of the community so that transmission can stop. Therefore, the accommodation does not need to be a health institution. In fact, if it's a health institution, it makes it far more expensive. It can be a hotel. It can be a large classroom that has been modified and beds put in, etc. But certainly, for the majority of those that have mild to moderate infection, they don't need to be in a sort of hospital setup. All we need really is for them to be taken out of the community and be put in a comfortable place where they can be isolated and they can be monitored in the event that they become more sick.
When you talk about the guidelines, compliance and enforcement, you say that these guidelines are quite easy to follow. And some will say, well, obeying traffic rules that's quite easy also. But then there's some form of enforcement in place. So when you talk about enforcement, what are you looking at? What is the PTF looking at to enforce this thing? Because, yes, they might be easy, but there might still need to be some form of enforcement. So what are you looking at?
So, of course, if you look at the Quarantine Act 2004, it talks about enforcement and the possibilities of persecution. We are also writing up a regulation around the Quarantine Act 2004, which we hope to get signed and then published. And that will also talk about the side of enforcement. But whenever you are having behavioral change, enforcement is not the first element. The most important element is to get the cooperation of the public, to get the public to understand those risks. So, for instance, if there are models, when people look up on the computer, there are models that you can look at where you put the number of activities, whether you go out, the number of people you see, whether you wear a mask, etc. And it will tell you what is the probability of you catching COVID infection. And that probability can be very high if you're coming across a lot of people, if you're going out every day, if you're not wearing a mask, if you're not keeping those social distances that are necessary, if you are getting into crowds, etc. And the higher the risk, the higher the probability that if this epidemic continues, you will eventually catch it. And what we don't want is a situation where, especially those that are likely to get severe infection, end up catching it and end up dying from it. Remember, this is still a deadly disease. In 20% of those that catch COVID, they would require hospitalization, and up to 5% would require intubation and ventilation. And even in the best health systems, if you are intubated with COVID, your probability of survival is about 1 in 2. It's about 50% or even less. And that's in health systems that are very strong, that we know are much, much stronger than ours and have the capacity to absorb a lot of shock. So don't go out and engage yourself in risky behavior unnecessarily, because you're putting your life at risk. You're also putting the lives of your loved ones at risk.
Right. Maybe something else that might help is to show people, or at least give them a sense of the consequence of their actions or non-actions, for example. And I'd like to know, you talked about some of the projections, the models you probably have used. Do you have a worst-case scenario that we're looking at, maybe at the end of this, maybe first 2 weeks? How many cases are we likely to record if we don't ensure that we follow these guidelines? Is there anything like that, a worst-case scenario model?
So there are various models, and the decisions that we have made in the past in the PTF, whether it was at the beginning when we first introduced the lockdown, and also more recently when we started lifting elements of it, we've been working very closely with academic colleagues and looking at different modeling scenarios. So yes, there is. But generally speaking, once you go beyond 100 cases, if you look at the various models of countries, of course, Nigeria might be slightly different, but if you look at the models for various countries, on average, the numbers double every 4 to 5 days because the incubation period may be up to 2 weeks. So, for instance, if we are at 2,000 now, if the epidemic is progressing at a pace where the interventions are not that effective, then you would expect the numbers to double in the next 4 or 5 days. But looking at our epidemic, they are doubling. It's taking a little bit longer to double, which means that possibly we are still seeing some effect. But more importantly, remember the incubation period will be up to 2 weeks. Therefore, the infections we are getting now are infections from people, the people that are coming up positive now, most likely acquired the infection about 2 weeks ago. We're not going to see the impact of lifting the lockdown until about 10 to 14 days after the lifting. In other words, it's not going to be now. The cases we're seeing now were cases that were acquired during the lockdown. So I think that's important. And also the exponential phase, as I said, it's an exponential phase. It goes up fairly rapidly. And what we're trying to do is to bring down that curve, what we call flatten the curve, allow the health system to be able to cope with the increased number of cases without really breaking down. And that's really our aim at the moment, to try and keep the numbers down, make sure fewer people are dying, make sure that our health services are ready to cope with that increase in numbers, make sure that our treatment facilities are ventilated, our intensive care units, for instance, are ready for that sort of aspect. But what the public really need to remember and need to keep on remembering is that with every activity, by going out, you're definitely exposing yourself. And if you don't need to go out, please stay at home, especially if you're above the age of 65 or you have other comorbidities. And even if you're not, yes, you might have a mild disease, but you can still carry it to your loved ones at home, elderly parents, etc. And we all have a responsibility to ourselves, but we also have a responsibility to our communities. COVID will go away eventually. It will. Every epidemic does. But what you don't want is for COVID to go away with you as well.
Doctor, by what you have just said now, it would seem like people are paying a lot more attention to the fact that they need to be alive and well, more than they probably fear hunger a little more than they fear COVID-19 at this point. But that's beside the point. Let me quickly, if you don't mind me taking you back to what my colleague asked the other time, Chamberlain, about the messaging. And you talked about, using the conventional media and some other influences. Are there peculiarities in messaging for different localities in Nigeria? Because, for instance, there are certain parts of Nigeria where people listen more to their religious leaders or to their, traditional rulers, while in other climes there are other media platforms that they use. Are you considering some social, religious, or traditional influences in the different sectors of Nigeria where the messaging might perhaps be a little more believable? Because it will seem like there is a distance of trust between the people and the PTF at this moment, or the messaging of the PTF.
Thank you. So actually, the PTF is not working in isolation. And remember, state governments are also there, and state governments' health remains on the concurrent list, including that of epidemics. The federal government is supporting this. We have been working very closely with the Nigeria Supreme Council of Islamic Affairs and the Christian Association of Nigeria. We've also been working with the Nigeria Traditional Leaders Council, and we're very grateful to these bodies. If you recall, some years back, there was a problem with the polio vaccination in northern Nigeria. Is there a problem now with that? Not really. How did they go about it? They were able to engage the traditional leaders and also the community leaders, because that's where the trust is. If your local imam or local pastor tells you do not do this because this is a risk to you, you're far more likely to agree to it, because Nigeria is a religious society. So we're working with those groups, particularly in Kano. We have reached out through the WHO and the primary healthcare setups. We have reached out to what we call facilitators in the local governments. We've also reached out to ward heads, to the traditional leaders that have been involved with the polio eradication. The Sultan has already made a statement, and we continue to push through these traditional communication outlets to make sure that the message reaches people. Because it's incredibly difficult for people to change their behaviors if they cannot see that risk visibly. If you don't have if everybody in your home is very well and they are going out and you're not coming across them, then whatever we say, at the end of the day, it will appear like artificial. It will not look that real.
Exactly. Pardon me, Doctor. One moment. It would seem like, there's a confirmation of what you're saying in the way the people have reacted or have responded to the easing of the lockdown, in that, people are not giving, much attention to social distancing or physical distancing. Those who wear masks don't even wear them appropriately, and even the security agencies don't seem to know, how to even handle the enforcement that is recommended in the guidelines. So would you say then that this messaging, this conversation with the people has actually been able to reach them? Or why do you think people are distant from the guidelines that's been recommended to them?
So I think it's not all parts of the public that are distant to that. It's all about perception of risk. It's also linked to literacy levels, for instance. It's also linked to people's desire to get back to a normal life. And I think it's our responsibility to continue to push that message that this epidemic is far from over. It is far from over. It's going to take us a lot longer to get on top of it. And therefore, we all have a responsibility to make sure that we protect ourselves. As I keep on saying, we would like to be alive next year. I'm sure virtually all of us would like to see 2021. But with every exposure to risk, especially if you fall within that group where you're likely to have a severe infection, with every exposure, you're likely to get into trouble. And COVID has no respect. It has no respect for whether you're male or female, rich or poor, government or a public officer or somebody on the streets. None. It's an infection that's spreading across the world. One of the things that I think has been very helpful is the fact that people with COVID infection have been coming out voluntarily to talk about their experiences. If you look at Kaduna State Governor, for instance, El-Rufai, he described in quite detail how he went through this illness. It's an illness that can be quite severe. And even in those that are fairly well and have no comorbidities, it can really bring you down. And if you're unlucky, you could end up dying from it. So
right.
we like the same way you wouldn't go out and cross the street when you see a speeding car. So also you shouldn't go out and expose yourself unnecessarily. The risks are
let me ask you on this. I know that there are different, the PTF gets, you talked about this previously, different media houses get inundated with different recipes or recommendations for a cure. Is there any local cure, or what is being done about research to get a cure? Anything being evaluated at the moment?
So at the moment there's an antiviral called remdesivir, which I'm sure you've heard in the US. They've recently given it temporary approval for use. But there's a clinical trial going on. There's also a large clinical trial being managed by WHO called the Solidarity Trial, which is looking at a mixed, at a different sort of interventions, different drugs. At the moment, there's nothing that we can say for certain, absolute certainty. There's no drug that has gone through the rigorous randomized control trials that we expect that would tell us for certain whether it works or not. But we are reaching out to our colleagues out there to make sure that whatever clinical trial that's coming through, like the Solidarity trial, for instance, we are engaged with. We also have a very strong relationship with the Nigerian Institute for Medical Research, NIMA, which continues to be one of the premier medical institutions involved in research. Whatever clinical trial is out there, we will try and get engaged in, and so that our own people can benefit. But having said that, I must make it very clear, at the moment, there is no medication that's been confirmed to be effective and licensed for COVID infection. None.
Okay, but
So,
all those chaps who are claiming that they've got local herbs and local methods of curing this, is it that none of them have come forward, or they've come forward but they just have not been validated? They made the standards.
So and there's no validated cure at the moment, none. And of course, I'm speaking from a scientific perspective because I'm a scientist. What we know is when it comes to medications, and as I keep on saying repeatedly, the reason why you take paracetamol if you have a headache and you take it with absolute confidence that it will work is because it's been through a rigorous randomized controlled trial. There are drugs out there that can be considered, but they are toxic. An example is hydroxychloroquine, for instance, which at the beginning of the epidemic, everybody thought it worked. But increasingly, a lot of the studies now coming up are showing increased mortality, increased risk of death in those that take hydroxychloroquine than those who do not when they have COVID infection, probably related to heart toxicity with the heart. So most of these regimens, if they are going to be used, they should be used in the context of a clinical trial. They shouldn't just be used like that haphazardly.
I know, because a lot of people are concerned. Yes, Gilead has not set a price for remdesivir, but, you know, some pricing watchdogs are saying it might cost over $4,000. You wonder how people would, be able to afford that right here. But, a lot of people still say they want to come forward. I get messages, people saying, you know what, we have an idea that might work. Is there a communication channel, maybe, that the PTF has that, you know what, if you've got anything, let us know. Is there anything like that, a communication channel that you have?
We do have a research subgroup, but at the moment, any sort of trial needs to go through the routine process of registering and implementation of the clinical trial. It needs to go through the normal rigorous process. Because we are in an epidemic, doesn't mean that we will jump the boat or cut corners, because that's the first step towards causing more harm than good. And as you know, in medicine, we should never cause more harm. We've learned from previous epidemics and also previous disease conditions. There was a drug called thalidomide many years ago that was used in pregnant women that stops them from having nausea and vomiting. And afterwards, a few years later, a lot of children were being born without limbs. And since then, the medical community has learned from this. Drugs that are not licensed should only be used in the context of a clinical trial, even if you're in an epidemic situation.
Okay, just give us a moment. Well, just a couple of more items to clear out, but we will be back in a moment. Please stay with us. All right, welcome back. It's our concluding moments now with Dr. Sani Aliyu. I know there's been a lot of talk, and there has been, perhaps there will be, because Kano, you remember earlier, there were reports that 70% of the doctors had absconded, saying if they didn't have any PPEs, they were not going to go back to work. Some of those reports are still making the rounds. In fact, this morning, it's been reported that one doctor has died as a result of some of these cases. So what can you tell us, perhaps in addition to statements ascribed to the PTF that no, we didn't link those deaths to COVID-19, I mean the initial one. So talk to us about that.
So, of course, Kano continues to be an issue of concern to all of us at the PTF as well as at the federal level. And it's very sad if a healthcare worker dies as a result of picking up an infection in the course of their duties. It's very unfortunate. From the PTF side, we have been working very closely with our partners. As we elucidated yesterday at the National Assembly, we have provided infection control training. We have sent out a large number of PPE to Kano, both to the state sector as well as to the federal teaching hospitals. Of course, fear is something that we need to overcome, and the best way of overcoming fear is making sure that you have adequate training and you know how to use the PPEs. There are private hospitals in Kano at the moment that are closed. A lot of the health institutions in Kano are closed, and I think the fact that people are unable to access health services very easily is also an issue of concern, because if you have a treatable disease condition like diabetes and you happen to become more sick, it's very important that you're able to access health services. We have been working very closely with the state government to make sure that health facilities across Kano reopen again. Now, remember, when it comes to PPE, it's not just the responsibility of the federal and the state governments. For private facilities, they can still buy PPE. The only part of the PPE that you cannot get locally are the FFP3 masks. These are the sort of the masks that you see that look fairly different, that some have a filter at the front of them. But generally speaking, surgical masks, you can get surgical masks from locally from local manufacturers. You can get the coveralls. You can get gloves. So we will urge all parts of the health sector, including the non-health sector, to try and get PPE as well. This issue is not just for the government alone. We have to come together and pool all our resources and make sure that our health workers continue to be protected. From our own side, we will continue to provide adequate training through the Nigeria Center for Disease Control, NCDC. As we said yesterday at the National Assembly, we have a large number. We have between WHO and NCDC, we have at least 37 persons or so at the moment in Kano, helping with different aspects of the response, helping to prop up the health system while Kano goes through this epidemic. So that's what I have to say. In terms of the report, we are yet to receive the final report of the deaths. That's still being investigated, as the chair of the PTF said yesterday and the Honorable Minister of Health. So it's really too early at this stage to say conclusively whether people are all dying as a result of COVID, or they are dying because they are unable to access those health services that are required. But we'll continue to work on this. It's really important that whatever signal we get in terms of increased mortality, regardless of whether it's during a COVID period or not, that it's investigated thoroughly and a decision is taken and public health measures are instituted to make sure it doesn't continue to happen.
Well, 2 days ago, there were reports that the PTF were considering another lockdown as a result of what they've seen. But is that going to happen now, having seen the way these guidelines are being complied or not?
We continue to monitor the situation very closely. As I said earlier on, the new cases that are coming up now were cases that most likely acquired the infection in the last 2 weeks. We are yet to see the full impact of relaxing the lockdown. That would come in the next 10 to 14 days, because that's the incubation period of the illness. If you come across somebody with COVID now, you're not going to get COVID tomorrow. The incubation period is between 2 to 14 days, and on average, it's about a week, because it takes time for the virus to establish itself within your respiratory system, to replicate, to multiply, and then to cause symptoms. So we will continue to monitor the situation very closely. What is very clear to us is if the current lifting of conditions is not adequate enough to control the infection, then it is our responsibility to make the necessary recommendations to government to strengthen the response and make sure that people are not unnecessarily exposed or put at risk of dying.
I'm going to have to just break the rule and make this, put two questions for you to respond to as we wind down. Now, what would you say to those who first say that governments at all levels have not been strong enough in their messaging and firm, ensuring that people are not hesitant in handling or understanding what they need to do about moving around and ensuring they comply with this, whilst also providing things for them to stay at home with? And then secondly, how are we responding, or would there be any advice from the PTF to the authorities, maybe to the president, about data? Many state governments say, look, the data to deal with some of this, now we've discovered, is a huge challenge. How are we going to respond to that so that we can have a national database for the country that we can rely on? Will there be any such consideration?
So let's start with the data. Actually, the data, I think the data for COVID is actually pretty good, because the data we have is enough for us to provide modeling for specific states with our academic colleagues. So the data is pretty good. And that's why we continue to have figures being reported. Of course, we can improve on the testing. And with the testing, our capacity has significantly increased. But what hasn't changed remarkably consistent with increase in capacity is an increase in demand. And that is where we have to work even more closely with communities. So for instance, I keep on talking about Kano because at the moment that's where the epicenter is for the north. But in Kano, for instance, we are activating a system that allows us to have at least 2 persons in every local government conducting house-to-house searches for people with COVID infection, and also helping to provide awareness. We have mobilized at least 3,000 people from persons from the polio side that will be going out into the communities and providing awareness, etc. So data is not a major issue. We have the SOMAs, which the NCDC are currently using to upload the cases. We can tell you with a significant degree of precision where these cases are happening. So for instance, in Kano, we know that they're happening within the metropolitan areas. So data is not the problem. The problem is trying to get more and more people tested, trying to remove that stigma and discrimination that's associated with this disease condition, and also making it easier for people to access testing. So, for example, we are looking at moving, instead of having mobile testing units, what we call rapid response teams, waiting to be called and then they go in and take your test, we will make sure that there are testing facilities in the hospitals. So if you go in with a headache and a fever, instead of being turned back, there's actually a testing facility for COVID where a test can be done, and people are isolated but also offered treatment. Because if you're very sick, you're not going to wait for a COVID result before you're treated. Otherwise, the risk of dying is very high. So in other words, we're pushing the surveillance not only into the community, but also into the hospitals. We're also looking at setting up testing sampling centers, what we call sampling centers, in every local government in Kano, working with WHO. And that will be critical because people don't need to go huge distances in order to be sampled and tests taken. But overall, it's the level of awareness, it's our sensitivity when we go out, the fact that we are constantly aware of the risks we are posing. If you go out and you go to a bus stop and you see a large number of crowds, keep away. Have a heightened sense of awareness that there are risks out there. There are activities that can potentially put you at risk of dying. So that's really important for us to continue to work with the general public, to work with our media people, to make sure that that message is being pulled out.
All right.
But from the data side, to be honest, I don't think we have a problem with the data side. Yes, there's some states we would like to see more numbers of people being tested. Because it's only by testing that you would know you have a problem. Oh, okay. And we will be bringing testing centers closer so that people can access them.
All right, we'll have to let it go at that point. Perhaps our colleagues will ask maybe the follow-up questions when you do have your briefing today, particularly because when you talk about coordination with states, government announces a lockdown, state announces you ease the lockdown. So it's managers find that a little confusing because there's supposed to be a national, interstate lockdown, but we'll have to let it go. We do thank you for talking to us this morning, Dr. Sani Aliyu, National Coordinator of the Presidential Task Force on COVID-19.